Understanding Schizophrenia and the Reality of Auditory Hallucination. An educational exploration of perception, brain chemistry, and the journey towards recovery through a clinical and human lens on managing complex symptoms. Schizophrenia is a chronic severe disorder affecting clear thinking, emotional management, and social relations, characterized by hallucinations and illusions that distort reality, requiring a comprehensive long term care approach for better patient support. Auditory hallucination types. Auditory hallucinations vary by how they interact with an individual, appearing as instructive commands, running commentary, multi voice dialogue, or familiar sounding voices. Command voices. These voices deliver specific instructions or direct the individual to act in specific ways. Commentary voices. A narrative voice describes the person's current action or thoughts, often critically. Conversational. Multiple voices talk to each other about anything, creating a sense of being observed. Known voices. Voices may sound like people the individual knows, such as relatives, or remain anonymous. Understanding non vocal auditory disturbances. Unclear murmurs. Perception of instinct whisper or muffled sound that are highly difficult to decipher. Ambient noise. Sounds resembling distant crowd chatter or audio playing faintly in an adjacent room. Wall of noise. Persistent auditory barriers that create a constant wall, severely disrupting the focus levels. Anxiety triggers. Confusion caused by these vague sounds frequently triggers significant stress and anxiety. Perception without stimuli. Auditory hallucinations involve perceiving sounds, often voices, despite no external source. For those with schizophrenia, the brain processes these are physically real, creating significant difficulty in daily life. Risk factors. Brain chemistry. Dopamine imbalance in the brain's mesolimbic pathway. Genetics. Family history increases individual vulnerability. Environmental. High stress events act as triggers for predisposed. Trauma and drugs. Past trauma or substance use worsen psychotic episodes. Hallucinations significant daily barriers. Persistent hallucinations create substantial challenges in everyday life, affecting concentration, social connectivity, emotional well being, and individual reality testing capabilities, which collectively elevate long term risk for personal and professional stability. Multimodal care combining medication and psychological support. Antipsychotics. The primary tool for managing schizophrenia, specifically targeting dopamine level to decrease both the frequency and intensity of persistent hallucinations. Practical rehab focuses on real-world rehabilitation, supporting patients as they gradually re-engage with education, employment, and meaningful social activities. Cognitive therapy equips individuals with practical techniques to challenge distressing voices and develop effective coping strategies to reduce the impact of symptoms. Family inclusions educates relatives to maintain a stable, low stress home environment, which is proven to be a critical factor in preventing future relapse cycles. Clinical diagnostic criteria for schizophrenia diagnosis. Initial presentation. Observation of primary symptoms include hallucination, delusions, and disjointed speech. Critical interview. A comprehensive review of personal and medical history to rule out alternative causes. 6-month benchmark. Symptoms must persist for at least 6 months with 1 month of active phase issues. Exclusion criteria. Ensuring that symptoms are not caused by substance misuse or other medical conditions. Final diagnosis. Formal confirmation based on standardized clinical criteria like DSM-5 or ICD-11. Empathy and care transform. Understanding the science behind the voices is the first step towards compassion and recovery. Through clinical insight and combined therapy, the focus shifts to social inclusions. Coping strategies for managing intrusive voices. Challenging voices. Learn to identify voices as symptoms of a condition rather than objective truths. Stress management. Using mindfulness or breathing exercises to lower the body's stress response. Auditory distractions. Using headphones or music to provide a competing real world source of sound. Peer support. Joining groups where others share similar experiences to reduce isolation and activity engagement. Focusing intensely on a hobby or physical task to shift away from stimuli.